ingrown hairs, and skin tags may make your skin crawl, so we're finding out how easy it is to get rid of them fast from author of Forget the Facelift, Dr. Doris Day. Welcome back.
Great, thanks for having me.
Overall, we're going to take a look at a few things here that may be bothering people's skin. What should we know?
Well, you know, these things may look unattractive. Some people even think they look gross. And they may or may not bother you or people who are looking at you. But the important thing to know is that they're benign, so you might as well get rid of them, but they're not anything to worry about in terms of your overall health and longevity.
So it's more of a social problem, maybe, or a confidence issue.
Yeah, but that's a big deal in terms of skin and self-esteem.
Absolutely. The first thing we're going to look at is fairly common, ingrown hairs, correct?
Ingrown hairs are very, very common, and women often get them in the bikini area. So I can't really show you a bikini area on daytime TV, so I found an ingrown hair on the back of the leg, and these often occur from shaving or waxing, and the tighter the shave or the waxing, the greater the chance of having ingrown hairs. So when somebody comes in and they have an ingrown hair, what we do is we do a little injection of a cortisone, and then this is just a little it doesn't really hurt.
What is this?
This is a cortisone injection, and when we inject it, then it calms down over the next few days. Now, the one thing you don't want to do, everybody knows, no picking. No picking at it, no pulling out the hair, because you just make it mad. You make it worse, and it tends to come back in the same spot over time.
On the neck.
Men get it in the beard area. And so the best thing to do...
you don't recommend a Brazilian wax?
Well, I recommend a Brazilian laser hair removal. When you get rid of the hair altogether, you get rid of the underlying problem. If there's no hair, there's no follicle there, then there's nothing to be ingrown.
And it doesn't grow back.
And it doesn't grow back. So there's a new laser called the Light Shear Duet. And what I love about this laser is it's great for men, great for women. It's a very big spot size. So you can do a whole leg in just 10 to 15 minutes.
And it just takes the hair out. How many cycles do you have to go of this? Is it expensive?
About 4 times at 1-month intervals, and it's as simple as holding it there. It's not painful. And then you just move on to the next spot.
Does that hurt, Lauren?
And
no pain here.
And what does that do exactly?
It just removes the hair at the source. So if you have lighter skin, darker hair, then it just gets rid of the hair, and you just keep pressing and marching along.
So
you can
can work on your mustache then, right?
It's great on anywhere you have hair. This works anywhere you have hair. It gets rid of it. You can do no gel, no pain, really, really fast.
You have to be careful of sun once you have this, correct?
Yes, you have to be careful of sun. But the nice thing is that who has time for a waxing? You know, you get a wax, then by the time you want to go to the beach, the hair is too long again.
Yeah, that's right.
The next thing I want to talk about, we're seeing lots of white dots that look like whiteheads right here. Are those, in fact, whiteheads or pimples?
These are actually called milia cysts. And these are very, very deep, and we're kind of going along with the theme of no picking. The worst thing you can do for these is to try to pick them out yourself, because they're very deep. It won't come out, and you have a greater chance of them coming back in the same area or leaving a scar.
How do you get those?
So sometimes it's genetic, but oftentimes it's from using products that are too heavy for your skin. So if you're getting a lot of milia, it helps to try to change to a lighter moisturizer or foundation. And what you see is, this is the isolase. It's one of my favorite treatments. It's great for acne, but it also helps extract the contents of the milia without creating trauma or irritation to the skin. And then there's an intense pulse light that gets rid of the redness. So you leave your skin is smoother and it's painless as well.
Is milia a form of like food intolerance?
Sometimes it's really, we haven't been able to identify it as such, but some people who have a lot of problems, sometimes cutting out dairy can help a little bit.
Is it like a whitehead?
It's different than a whitehead, because this is a blocked gland and that's a blocked pore. But this is what you can see of the milia, and then that's the protein that comes out from that isolase treatment. It's very rewarding. We kind of love our job.
Is this an expensive treatment to get if you have this? And
you can get a package of them. You do it in a few weeks. It's about $300 a treatment.
Next up, skin tags. So I've heard people get them because there are viruses in the body at times. Is that what these are?
Skin tags.
Skin tags.
Yeah, skin tags are outpouching of skin. They're not actually a virus. Warts are slightly different. They can look similar, but warts are caused by a virus. So we have Joe, who has skin tags. You can see there's a lot of skin tags on some people. And generally what we do for these, I numb this up just to make it easier for her. But basically what we do is, using very special scissors, again, don't try this at home.
Is she numb now? She's numb.
A little bit numb, yeah.
Did you use an anesthetic, right?
Yep. And then we just
Did that hurt?
Can you do that? Don't do this at home? Is this your advice
Don't do this at home.
No.
And then did that hurt at all?
I don't know.
Not a bit. I didn't
And then we just burn it at the base, very gently. And then that's it. She'll have no scar.
I have a beauty mark. Is this a skin tag or a beauty mark?
That's a tag.
That's a tag. You wanted to take care of it right now.
But I like it.
It's like a price tag. Now, I have one question. Do these reoccur? When you do this, is it something that you have to, it'll come back in 3 months and then you're
The same one does not come back, which is really nice. So what I always tell my patients is you grow and then come in and I'll harvest. So, so people grow a lot of them, and every few years we come in and get rid of them.
Now, we're now seeing pictures of one of the nastiest rashes that we probably have ever seen covering the torso here. What exactly is this, and how do you know if it's dangerous medically or not?
Well, this is a very common condition. There's thousands and thousands of cases of this a year. It's called Pityriasis Rosea. It is probably caused by a virus, and often you see that first one. That's called the Herald patch or the mother patch. That's a couple of inches big. It's pink with central scale, so it's a little scale in the middle. And then as that clears, you get crops of new ones. And we're actually in the season for Pityriasis Rosea
Is
right
it
now.
contagious?
It's not contagious.
Okay.
Sometimes itches a little, sometimes a lot, sometimes not at all. But the good thing about it is that it doesn't occur above the neck or below the knees or below the elbow. So it's kind of a middle of the body rash.
Sure.
So around this time of year, if it happens, you can wear a turtleneck. And it's not something that has to be treated. If it's, you know, it's going to run its own course.
Okay.
But if you
Like
feel
how
you
long
want
will it
to, a few months.
It'll last a few months.
And
But you
it comes
can't
in
use
crops.
anti-allergy medicine for
Right,
it?
so use antihistamines, topical cortisone,
Okay.
and sometimes we don't like to tell people to go out in the sun, but sometimes a little bit of sunlight can help calm it down as well.
Okay.
So there are things you can do about it, but it goes away.
Thank you. Okay, obviously, if you have something on your body that you're concerned about, go to your doctor and get it checked out. We want to thank Doris Day for being here, and we'll be right back. Thank you. Thank you.